In this video, we'll discuss about Treponema pallidum, Spirochete. It is a spiral shaped bacterium, so it have that name Spirochete. Morphology, this one is thin, delicate spirochete with a tapering end. This is not seen under light microscope, but it can seen by negative staining with Indian ink staining. Treponema pallidum can be visualized under dark ground or phase contrast microscope. It is stained by silver imbrication method. Giemsa staining and silver imbrication method. The Treponema pallidum consists of 3 or 4 endoflagella. Endoflagella means it is presented in between cell wall and cell membrane. This is all about morphology of Treponema pallidum. Thin, tapering end, better seen under dark ground microscope, staining, Giemsa and silver imbrication method. It have 3 or 4 flagella, that also endoflagella. Flagella presented in between cell wall and cell membrane. Next, antigenicity. Antigenic structure of Treponema pallidum is very complex. The Treponema pallidum infection, 3 type of antibodies are produced. First one is reagent antibody. This reacted in standard or non-specific test for syphilis. This test include Wassermann test, Kohn test and VDRL test. The antigen is used in this test cardiolipidin antigen, second group specific. This is found in Treponema pallidum as well as non-pathogenic cultivatable Treponema. Third one is polysaccharide. This is species specific, species to Treponema pallidum. So 3 type of antigenic structure, 3 type of antibodies produced, reagent antibody, group specific antigen. Next one is polysaccharide, species specific polysaccharide. Next, pathogenicity. Natural infection with Treponema pallidum occur only in human. The infection syphilis, it can be venereal, sexual route. Second one is that congenital, from infected mother to infant. Third one is non-venereal, non-sexual. So it have 3 main route of transmission: sexual route venereal, from infected mother to infant congenital, then non-sexual. This syphilis can occur adult, mainly sexual route, then congenital through infected mother to fetus. It have stages. First one is primary syphilis. Primary syphilis characterized by hard canker on genitals. What is canker? It is a painless, avascular, circumscribed, inturated, superficially ulcerated lesion. So this one is painless, avascular, circumscribed, inturated, superficially ulcerated lesion. This canker is covered by thick clary exudates, which is rich in spirochetes. This stage regionally lymph nodes are swollen, non-tender, and the primary syphilis heal within 10 to 40 days. Even without treatment, it progresses to secondary syphilis. If not taken treatment for primary syphilis, it progresses to secondary syphilis. Next, secondary syphilis. This occurs 1 to 3 months after healing of primary lesion. This is due to increased multiplication of spirochetes and they get disseminated through blood. Disseminated through blood throughout the whole body. So here the characteristic lesion are papular skin rashes, mucus patches and oropharynx, then condyloma, or macular condyloma or maculopapular rashes in the skin fold area. So condyloma presented in mucocutaneous junction. These three characteristic lesion of secondary syphilis. It is most infective stage of syphilis. So it will causes skin rash, mucus patches, then oropharynx. Last one is condyloma. These condyloma are maculopapular rashes in the skin fold area. It is presented in mucocutaneous junction. This one is the most infective stage. Next, tertiary syphilis. There is systemic involvement. Many systems are involved. Most common system is CVS, cardiovascular system, leads to disease like aneurysm and CNS producing neurosyphilis. So tertiary syphilis, systemic involvement. Many systems are involved, mainly affected CVS. It leads to disease aneurysm and CNS primarily producing the CNS producing neurosyphilis. So second one is congenital syphilis. This occur through vertical route. That is, it is transmitted from mother to child. It is transmitted from mother to child. It have two types. One is early and the second one is late. Early syphilis, it occur within 2 years of age. It is characterized by vesicle and fluid. There is fluid filled in lesion, vesicle less than 5 cm and fluid are large. The fluid filled lesion which are more than 0.5 cm. So here early stage this congenital syphilis, two stage is there. Early stage within 2 years of age, it causes vesicle and fluid. This vesicle that fluid filled that lesion less than 0.5 centimeter, that fluid 0.5 more than 0.5 centimeter. So next one is late stage. Here the characteristics, it occur after 2 years of age. That characteristic Hutchinson triad. Here it will cause that involvement of interstitial keratitis, then sensorineural hearing loss, then Hutchinson teeth. So triad, interstitial keratitis, sensorineural hearing loss, then Hutchinson teeth. This one causes after 2 years of age. This one will cause within 2 years. Here it will cause vesicle and fluid. This one is preventable only, giving adequate treatment before 3 months of pregnancy. This congenital syphilis can be prevented by mother giving adequate treatment before 4th month of pregnancy in the mother. And then last one is non-sexual, that means non-venereal syphilis. This is from doctors, nurses, blood transmission. It is transmitted, but this one is the rare condition only. Coming to laboratory diagnosis, specimen serum in the case of neurosyphilis means CSF. is collected. Microscopic identification, it is used for diagnosis of primary, secondary stage and congenital syphilis with superficial lesions. Then dark field microscope used in which slender spiral structure and show that movement of Treponema pallidum. This one indicate that presence of Treponema pallidum. Dark field microscope, slender spiral structure, slow movement of Treponema pallidum can be identified. Then second one is direct fluorescent antibody test, silver implication test. Under this Pantana's method also used. Under this we can use Pantana's method. Then serology, that include two type of test, non-treponemal and treponemal test. Non-treponemal test also called standard test. Reagent antibody are detected using cardiolipidin antigen. It is derived from beef heart. It is non-specific, that is presented in all treponemal bodies. Most commonly used test are VDRL, rapid plasma reagent test. Then treponemal test, this one also called as specific test, used for confirmation. This one specific antibody are detected using Treponema pallidum antigen. It is consists of fluorescent Treponema antigen absorption test. This one is the gold standard test. Then Treponema pallidum heme agglutination test. This one most common and specific test. After that, one more test, immobilization technique also we are using. Third one important test, immobilization. Immobilization test also we are using. Then prophylaxis, avoid sexual contact with the infected individual, use of physical barriers, antiseptic and antibiotics. No vaccines is available for treatment of syphilis. Treatment penicillin, uniformly effective. It causes allergy, means doxycycline and ceftriaxone are using. Penicillin is causes allergic, means doxycycline and ceftriaxone using for treatment of Treponema pallidum.